This skin is a prison. It's just a massive wall hanging from me that stops me from doing anything. And it's brought my life to a standstill.
I'm a real plastic surgeon, and that could be the most skin I've ever seen on a person.
The highest weight I was at was 625 pounds. I felt like $1,000,000, but then started to notice I didn't look like it.
So what is going on with his abdomen? As you can see, he has what's called an abdominal panniculus, and this is a scientific term for excess skin hanging from the abdomen. But what is that other part of skin that is below his abdomen? Well, I think I have an answer for you, but let's learn a little bit more about his story first.
I've gotten to the point where the skin is hindering everything right now, and it's preventing me from losing more weight.
So how could having so much excess skin prevent somebody from losing more weight? Well, the main driver of weight loss is how much you eat. It really is about calories in the end. That being said, exercise can play a part in it. In his situation, if that skin is so excessive that it's in the way and he can't really move around very well because of it being in the way, with chafing and even infections underneath that skin, well then that can limit his ability to exercise and to burn extra calories. Now that doesn't mean he can't lose weight by eating less food, but it means that he can't burn those extra calories to make that weight loss happen even quicker.
In the first year, I had lost 200 pounds. Gravity took hold, and my excess skin started pulling down.
As a plastic surgeon, I see this all the time in my clinic. Patients who've lost large amounts of weight, and although the fat has disappeared, that skin doesn't disappear with it, so it starts to hang. Now we do see this type of skin excess, not to his extent, but skin excess in people who've lost anywhere from 40 pounds or more. The average that we see where somebody has a lot of extra skin, usually they necessitate anywhere from 80 pounds or more of weight lost. And there are operations that we can perform to remove this excess skin, whether it's from the abdomen, the arms, the thighs, but they are big operations with big and long scars.
Now I have an apron of skin that hangs past my knees. All of it started slowing me down.
So it looks like he has two technical aprons of skin. There's the one that's above, and that is his panniculus, and then there's the one that is below that. And I do suspect that that is a lymphedema mass. When people gain large amounts of weight, they can get these masses of lymphedema. And it's basically a skin-covered sac that is filled with lymphatic fluid and fat. These masses, like the pannus that is hanging from his abdomen, can be excised, but once again, these are big operations with lengthy scars.
I've been waiting for this for over 2 years. I'm nervous because he's about to come in and I can't even sit on the exam table, for crying out loud.
So the big question in my mind about Matt's visit today to see a surgeon is that, is he at a healthy enough weight to have a big operation like this done? In general, when you are morbidly obese like Matt still is, now he has lost a ton of weight and he should get so much credit for that, but he is still a very large man, and the larger that you are, the higher risk of anesthesia related complications and surgical complications as well. And the way we look at it as surgeons is, do the risks outweigh the benefits? And if the risks are really high because he's unhealthy, those risks very well could outweigh even those immense benefits of getting rid of all of that excess skin. So let's see what his surgeon says, because it really depends on the surgeon in these situations.
I'm here to get all the excess taken off in this ball so I can have mobility back.
Oh, he's in trouble because his surgeon is Dr. Now. And Dr. Now does not mince words. And if you watch his show, My 600 Pound Life, you'll know he does not bull.
Let's just check your weight and see what we got here. 563. So it seems like you have gained a lot of weight back.
You know, whenever Dr. Now tells you to step on a scale, that you could be in big trouble. He'll say things like, you need to bring your total calories down to 1,500 calories per day. Or he may ask you, who's feeding you? Is he feeding you? Is he an enabler? The good thing about Dr. Now is that he does not BS. He's gonna tell you the way it is, and there is some tough love going on here, so let's see where he goes with this, because obviously he is not happy with Matt gaining this weight.
Matthew has a lot of issues, and right now the main thing is that he's too heavy.
So Dr. Now's decision is that he is too heavy to have skin surgery. He will need to lose at least 150 to 200 pounds. But we may test him first by having him go on a 1,000 calorie diet per day. And then we will weigh him again and see whether he will be good for the skin surgery. Now, Dr. Now is actually not a plastic surgeon. He is a bariatric surgeon, in which case his operation that he is mainly trained to do is to remove portions of the stomach to allow it to become smaller so that the person eats less and eventually loses weight. Now, this skin surgery that he talks about, paniculectomies, breast reductions, things like that, those are operations that technically are usually performed by plastic surgeons. But the problem that a lot of bariatric patients find is honestly there aren't a lot of plastic surgeons willing to take insurance reimbursement for these operations. Insurances pay so little for these operations that the vast majority of plastic surgeons won't perform them for the reimbursement of insurance companies because that reimbursement is so small that you actually lose money in the end by performing those operations. Essentially, the overhead to keep your practice up is higher than what you get paid by insurance to perform those operations. So I really give kudos to Dr. Now for performing these operations for his patients because in the end, he may actually be losing money performing these operations than actually making money from it. Have you tried my exclusive skincare line, Youn Beauty? Our products combine natural and organic ingredients with the latest and scientifically proven anti-aging components like vitamin C, retinol, and peptides. If you're looking for healthy and youthful skin without the unnecessary chemicals, fragrances, and additives, then this is the skincare line for you. I'm so convinced that you will absolutely love my skincare products that I've instituted a 30-day money-back guarantee. Check them out at younbeauty.com and enter the coupon code 20OFF to get $20 off your first order over $99. I'll put a link in the caption below.
Matt's fat is pulling down his stomach skin very low and has developed a lymphedema mass that is hanging from his abdomen.
So that is a lymphedema mass like I described earlier, and I suspect that it's hanging from his upper pubic area. Now this can be excised and removal of that could really make a huge difference for Matt.
And to even take this off, we need you to lose weight.
Okay, so how much weight, Dr. Now, does Matt need to lose before you consider performing his surgery? I would guess upwards of 150 to 200 pounds, but let's see.
This is where the body stores extra fat. If we go ahead and take this off and you get 20 pounds, it's gonna go back to the same place.
Now the most I've ever removed from somebody in a tummy tuck weight-wise is about 25 pounds. You know, some people think, oh, I'm gonna have a tummy tuck and is it gonna make me lose 10 pounds? Well, the vast majority of tummy tucks that we perform that are performed on the people who have, let's say, lost significant amounts of weight, let's say 100 pounds, sometimes less, or that have had multiple children, so the skin has been stretched out in their tummy. Usually the amount that we remove is maybe a pound, maybe 2-3 pounds. I did have a patient with 25 pounds, and this is a woman where the skin, like Matt, was hanging all the way down to her knees. But as you know, Matt weighs 560 some pounds. That's a lot of weight, and a lot of that is centered in that abdomen. And when you're thinking about removal of literally 25 pounds, and that being the most I've ever removed, that pannus that he has weighs a lot more than that.
So in 3 months, you need to lose 150 pounds. Maybe we can take the mass off.
Okay, so 150 pounds lost would get him closer to around 400, 410, 420. That's gonna be much more doable, but still, he is a very large man, and even anybody at that weight, there are high risks with anesthesia.
I just hope I've done enough to lose the 150 pounds.
All right, 477. It looked like you lost 85 pounds.
Well, 85 pounds is a huge amount of weight to lose in just a handful of months. So I really credit Matt. Great job with doing that. Let's see what Dr. Now thinks now about doing that skin surgery. In my opinion, as a plastic surgeon who's performed thousands of operations, he's still a bit large. I don't know that I would feel comfortable doing that.
You have too much fatty tissue, which is going to be a significant cardiovascular strain on your condition. I cannot approve you for surgery.
Well, that is really disappointing, but it is understandable from Dr. Now's standpoint. The worst thing that can happen if you're a surgeon is to have a patient have a cardiac event like a heart attack while they're on the operating room table. And why can that happen? Now, when you're under surgery, your heart is under a greater strain than it otherwise would be. Now, because he is so large, he has a heart that is trying to pump blood to all of these parts of his body. And it's working really hard because his body is so large. When you undergo surgery and you undergo anesthesia and you're losing blood and you're having pain receptors that are activated throughout your body in those areas that you're operating, that is a stress and a strain to the heart. And if that heart is already kind of at the top of what it can do and it needs to pump out blood more, then the risk is that you could have a heart attack or some other significant damage to the heart that could be potentially fatal.
Is there a number we're shooting for?
70 pounds is going to be what you need to lose before the surgery is going to be safe.
So Dr. Now is really sticking to that right around 400-pound mark for him to have surgery. And I think that's important because if you're going to have surgery, you want to make sure your body is optimized for it so that you have the least risk of complications.
Unfortunately, it may take a lot longer before Matt can be ready for skin removal surgery.
I often see patients in consultation who, like Matt, are interested in a tummy tuck surgery to remove excess skin, but unfortunately their weight is at a level that I feel is not healthy or beneficial for them to have an operation. In those cases, I actually don't put any type of a time frame that they have to stick to, let's say losing 40 pounds over 6 months or anything like that, because really I think the key is that if you're gonna lose the weight, to lose it in a way that you can hopefully keep it off long term. What's not going to help somebody like Matt is to lose a bunch of weight quickly, have an operation, and then gain that weight back, because now they're back pretty much where they started. And so with my patients, I usually encourage them, take your time, do whatever you need to get yourself to a healthy, maintainable weight so that whatever we do, plastic surgery-wise, you can keep that result hopefully for a very, very long time.
It was a hard pill to swallow at first, but I know Dr. Now is looking out for my health. So I'm going to keep losing the weight until he says I'm ready.
Well, good for Matt. I really wish him the best, and I look forward to seeing Dr. Now get rid of all that extra skin for him, hopefully in a future episode of Skin Tight. Now, if you want to see a woman with almost the exact same issue with a massive lymphedema mass hanging from her pubic area, and that actually get removed, take a peek at this video right up here where I react to an episode of Botched Bariatrics. Her anatomy is going to look a bit surprisingly similar to Matt's, so it's going to be absolutely fascinating to see how that skin and that lymphedema mass is removed. And as always, remember to eat real food, use clean skincare, and auto-rejuvenate before you operate.